The decision to have spine surgery can be very difficult. With the myths floating around spine surgery, that decision might be even more difficult.
Signing up to go ahead with surgery can be daunting, and in this video we'll debunk the top 5 myths surrounding surgery. Be sure to speak to your physician if you have any concerns. This is Mohammed.
This is Andy.
This is the Neurosurgeons channel.
And this is the only place where you find 2 neurosurgeons talking to you about everything about the brain and spine. Myth number 1, all spine surgeries are major surgeries. The spine is a big part of the body, and definitely having surgery in the back is a big thing. However, not all the spine surgeries are major. The spine surgeons might be able to do surgery in your back with very small cuts in the back. If you're having specific conditions like lumbar disc prolapse or lumbar canal stenosis where there is tightness around the nerves, the surgeon might be able to solve your problem with very small cuts. Other surgeries in the back might be bigger, which might include fixation of the spine, or bigger surgeries if you have deformity within the spine like scoliosis. Most of the spine surgeries are short and fast. It doesn't require much stay in the hospital, and these surgeries doesn't cause much scarring or damage to the tissues and subsequent infection or long stay in hospital.
Myth number 2 is that a spine specialist will always recommend surgery. Surgery is part of the treatment options for people with back or leg pain, but it's not the only one. When you see a spine specialist, they may not necessarily advise you to have an operation. Other things that they may advise are physiotherapy, acupuncture, or joint injections. Please check out our other video on ways to treat back pain.
Myth number 3, recovery from spine surgery is extremely painful. It's normal to feel pain after spine surgery. However, this pain can stay for about 1 or 3 days after the surgery, which is usually in the back, which is the site of the operation. But usually you will feel relief, especially in the leg pain, immediately after the operation, and the back pain will usually go away within a few days. Some patients might experience longer periods of mild back pain for about 6 to 8 weeks, but hopefully all of that will resolve after that time. It's extremely unlikely that you get severe back pain or leg pain after the operation. If you develop any of these symptoms after your operation, where you have severe back pain or leg pain or problems with control of your bladder and bowel, this might be something that you need to seek urgent medical advice and speak to your surgeon about it.
Myth number 4 is that it takes forever to heal after back surgery. There are many factors which determine the rate of your recovery after your spinal operation. These include your age, the part of your spine that has been operated on, the type of operation you've had, and very importantly, your overall health. For example, recovery after a relatively small procedure like a disc operation can take a couple of weeks for you to recover. However, a more major operation like spinal fusion can take many months and sometimes up to a year for the bones to fully heal. If you have concerns about the recovery process after your operation, please speak to your surgeon before your procedure to make sure your expectations are realistic in terms of if you can go back to work or perform exercise as part of your recovery process.
Myth number 5, you will get addicted to painkillers after surgery. After surgery, you will be prescribed different type of medications to help you with the post-operative pain. One of these medications are called opioids. You can get addicted to opioids if they are used for a very long time. Your surgeons and your medical team will make sure that all of the medications that you're taking are safe and suitable for you. Opioids also are not the only medications that are used after the operation. The surgeons can use other medications like anti-inflammatory drugs, which help ease the inflammation because of the surgery. Also, after the surgery, you will not be relying only on medications, but you will be seen by the physiotherapy team who will help you to do a lot of exercises that can also ease the pain.
Bonus fact, spinal surgery can be a real game changer with regards to your quality of life. Signing up to have an operation can be very daunting, but if you think this may help you, please discuss it in detail with a spine specialist. In our next video, we'll talk about the medications often prescribed to treat your back and leg pain.